Whether big or small, you're going to experience injuries in this life. It's not a matter of if, but rather when. So stare that fact in the face and accept it. Now, thankfully, we've been given bodies that always fight on our behalf, working to recover from what has been injured. And we all know that injury rehabilitation exercises can be helpful with this, but how do we ensure we're getting the most out of them? Like anything else, when it comes to rehabilitating an injury, you usually get out of it what you put into it. And if you're going to do exercises that help heal your body, you might as well maximize the benefits. So in this episode, we're diving into the what and why of rehabilitation exercise, including how to avoid common mistakes that hold us back from optimizing the therapeutic stimulus they can provide. And by the end of this episode, you'll have a better understanding of how you can tackle these issues on your own and feel greater confidence with knowing you're not wasting your time with the exercises and movements you're performing. So let's get to it. Hello again, everyone. Welcome back to another episode of the Strength Resurgence Podcast. This is episode number 7, where we're talking all about getting more out of rehab exercises. Now, this is one where there can be a whole lot to talk about in this whole world of exercise rehabilitation and physical strengthening and physical rehabilitation. So we got to kind of be selective with what we're going to talk about. And so in this episode, rather than just blab on forever, we're going to do this in a way where we try and cover a lot of ground in a quick but very meaningful way. So appreciate all of you tuning in to listen to the topics on this episode. I think there's some really valuable insight that anyone who wants to learn how to kind of help rehabilitate their body will get out of this. So as we get going, as always, I want to thank you very much for being here. There's no shortage of podcasts out there to listen to. And so it means a ton when anyone chooses to listen to these episodes and to tune in. And I really, really appreciate that. So if you don't know me real quick, my name's Jim. I am a physical therapist, strength and conditioning specialist, and someone who wants to take all his years of geeky knowledge and, these kind of couple of decades now of experience and training, and I want to just give it all back in ways that can help enrich the lives of others, which is exactly why this podcast exists, because, hey, we all got to geek out about something, right? So on this podcast that I'm starting to kind of get going here, this is all about just creating conversations around pain and injuries and really trying to explore the life-enhancing effects that can be gained when we work to write our own comeback story. Because I think all of us have a comeback story that we can write from the physical ailments or conditions that are holding us back. And if you don't feel like you need to have a comeback story right now, that's awesome. But maybe one day down the road, you'll find yourself in that situation where you will. So nonetheless, as we get going, as always, I like starting out these episodes with just a really quick, fun little fact about me unrelated to the topics and concepts of this podcast, just so that you can remember you're spending time with just another fellow human being like you. And so I thought I'd let you know with the NFL season kind of really starting to get into playoff season here that my favorite NFL team right now is the Buffalo Bills because I consider Buffalo kind of my home away from home. I used to spend a lot of my summers out there as a kid. I live in Western Canada now, out in Calgary, Alberta. But between spending a lot of my summers out there and Christmases even as a kid, and then actually winding up doing graduate school out there for physical therapy or physiotherapy, I spent a lot of time out in that city, and it's got a special place in my heart, home away from home. So I used to actually be a really big New Orleans Saints fan when Drew Brees was playing, but he retired. And so because of that, I've kind of jumped back onto the Bills wagon once again. So go Bills. Hopefully we'll win a Super Bowl at some point anyways. But all right. So what is in this episode? Let's kind of start getting into what you tuned in here for. So in this episode, we're going to talk about the what and the why of rehab exercises, rehab being short for rehabilitation. And we're going to talk about what we call active and passive strategies for recovering from injuries and kind of whether we want to use an active or passive strategies or both. Talk about that. We'll talk about an analogy that works really good for kind of this art of creating physical movement as medicine. Great analogy we'll kind of dive into with that just to really kind of help tie some concepts together. Then we're going to talk about the difference between exciting versus effective exercises. That's always a fun one to get into. I have to have that conversation with patients a lot as they work to get through, what's kind of holding them back with their injuries and their aches and pains and their situations that they find themselves in. So we'll generate a brief conversation around that. Talk about starving the ego and what that kind of means and why we want to maybe consider that as an actual powerful strategy when it comes to injury rehabilitation. We'll talk about intentionality and why that's going to be an important thing to be mindful of when working to craft your comeback story from injury or a condition, whether it's a surgery or just a simple rolled ankle, whatever the condition or situation that you're going to have to kind of battle back from. Intentionality is going to be a huge portion of that, I would say. We're going to talk about the concept of just kind of understanding the process. That'll be a really good one to go through. And then we'll talk about just progressing exercises and kind of when and why and how and what needs to be done with that. I mean, there is so much that we could geek out and talk about in this episode. Basically, when you think about it, what I'm kind of covering in this episode is what people spend, years in school learning and having to devote years of practice to in order to do to help other people out. And we're really just condensing it into a very, very short podcast episode. So by no means are we covering everything. And a lot of what we're covering today is just very kind of conceptual in nature, but it'll serve as a wonderful starting point for so many people who just need to kind of get themselves pointed in the right direction. And then, of course, we'll wrap things up with the practical takeaways as we kind of land the plane for the episode. Because again, what's the point of talking about all these things if we don't kind of just give you some practical takeaways and things that you can consider as you kind of embark on your recovery? So that's what we'll be going over. But I figured right before we get into that, let's start out with just a basic question to ask here. I like asking questions at the start of these episodes just to help kind of mentally start turning some gears a bit and kind of maybe help you to see kind of how you fit into the episode and the concepts we're talking about. So anyways, I wanted to ask a question here. And the question is, what comes to mind when you think of the words rehab exercise or rehabilitation exercise? Wondering what that means to you, kind of what comes to mind. And whatever it does, just hold on to it. And maybe it'll plug in quite nicely to what we're going to talk about here. Or maybe you'll kind of walk away with some new thoughts or angles to view this whole rehab exercise thing from. But nonetheless, that's the question I wanted to ask you here. So now let's quickly talk about the big problem that we're trying to solve. And again, I really like framing up these kind of podcast episodes by being a little bit more in tune with the actual, like how do we phrase this, right? How do we kind of put into words what it is we're trying to solve for these episodes? And so realistically, there's kind of a couple of problems that maybe we want to consider solving and then using the concepts in this episode to help solve that problem or these particular problems. So the first one is, how might we provide our body with the best outcomes possible for physical rehabilitation involving decreasing pain and improving physical function? So how do we give our body the best outcomes possible, right? How do we do that when we need to make the body stronger, more robust, or when we need to decrease pain? How do we do this if we want to optimize the function of the human body or the physical capacity of it? I mean, surely there's no shortage of answers, but this is kind of where we're starting in this episode, is how do we give ourselves the best chance of any of this? Decreasing pain, improving performance, improving movement, functional quality, functional capacity, whatever it's going to be. We got to maybe consider the best way that we go about doing that. Now, this is especially true to ask ourselves these questions when we may not have access to maybe other helpful interventions or modalities or even healthcare practitioners that we would otherwise like to have to help us out with this process. I think in some regard, the whole concept of how do we, help ourselves out to become better, stronger, move better, decrease our pain, it becomes a pretty simple answer if we have unlimited resources and an unlimited network of people to work with to help us out. I mean, just imagine that you just had no shortage of money it was not is not a consideration for you at all, you had anything you wanted at your fingertips, well, the game would change then, I think, to at least a very large capacity. But realistically, this is not where most people are. Most of us know that, hey, we could do better and get better outcomes if we had the right people to work with and guide us, and the right interventions and modalities that we don't have access to on our own. But we got to think about kind of really the difference between a perfect world of having access to all that versus the real world. Now, when you create a podcast, you get people from all walks of life who are perhaps tuning in, and maybe some of you out there are living in a perfect world where you don't really have to worry about budgets and finances and limitations, and you have access to all sorts of health networks and modalities and interventions and whatever it's going to be. But I would imagine that most of us are kind of in this different world where we don't have access to that. And so that's where this kind of main problem comes into solve that we're trying to tackle in this podcast episode. And that's just, we know that there might be things out there that help, but we don't have access to them. So we're kind of grounding this whole podcast episode in the world of how do we take matters into our own hands, working with what we've got. Now, if these resources are limited, then how do we get the most, the absolute most out of what we have access to and what we do have control with? So again, some of us might have access to a few more resources than others, but no matter where we're at, basically what I'm trying to ask here is how do we give ourselves these better outcomes if we're limited with what we have to work with? So we'll kind of start solving that problem. And then the other problem that we'll kind of think about and frame things up here is how, in this process of trying to write our own comeback story, get out of pain, improve function, all that type of stuff, how might we help ourselves to feel empowered and in control of navigating and overcoming these injuries or conditions that we may be facing? And I think that's a really important one, because I think a theme that I'm often addressing in these podcast episodes is we always have to acknowledge the physical aspect of what we're trying to do with injury rehabilitation, building strength, endurance, functional capacity, dropping pain, all of that. But I think we really have to acknowledge the psychological component that goes into all of this as well. And in the last episode, we kind of talked about how we can view a lot of this either through the traditional lens of the pathoanatomic model for health and wellness, but also we talked about that other model that exists called the biopsychosocial model. And in this case, that's kind of how we're framing this. We got to consider the physical aspect of the body, but also kind of the psychological portion that comes with a lot of this. So we will be getting into some of that, but nonetheless, let's give you the big takeaway here, and then we'll really extract this and dissect this and kind of see how we arrive at this kind of big takeaway here. So when performed properly, and this is the big takeaway we're trying to get at here. When performed properly, physical movement and specific exercise interventions can absolutely provide the body with the stimulus it needs to heal and improve physical function from various injuries and conditions. So what we're trying to say here is that there's always something that we can do if it comes down to us and only us, and that's with a lot of this kind of rehabilitation exercise to get ourselves moving in the right direction. Now, that being said, exercise alone often won't solve everything, but it should typically be considered as a frontline strategy for promoting therapeutic stimulation for the body to adapt in favorable ways. And those favorable ways can be ways in which we decrease pain, which is very important. We kind of decrease discomfort that we get, but also using physical exercise to promote better movement, more optimal ranges of motion, help the body become physically stronger, to adapt to become more robust. There's so many kind of ways that we can use physical exercise and movement to make this happen. And as we get into this here, it's important to note, and I'll mention this a little bit further more in a moment, but we're really looking at the concept of exercise today through the lens of physical exercise. There's so many more ways that we can consider what exercise is from injury rehabilitation. And I will get into that a little bit, but as we get going here, just know that this whole episode in particular is rooted around kind of physical movement for exercise. Now, hopefully I'll create more podcast episodes in the future where I will actually kind of talk about these other kind of methods of what we call exercise. But for today, this is all kind of the physical aspect of it. So in that regard, maybe we should start with a definition where we can kind of figure out or orient ourselves and ground ourselves in what we're defining exercise to be. So in this case, we're going to define exercise to be bodily exertion performed for the sake of improved physical health and functional abilities. So that's just going to help to make sure we're all on the same page here as we progress and go along in this episode with these concepts. Now, bodily exertion can be considered as any activity that places stress upon a bodily tissue or system, forcing it to adapt. So I think most of us will think in this regard about tissues and systems as like muscles, the musculoskeletal system, and helping muscles to recover from injury, to heal up, to become stronger. And that's certainly the case. But just keep in mind there can be other tissues that we factor in as well throughout the body. And we'll kind of get into that here in a moment. But for now, what's important to understand is that when we're talking about exertion, well, this type of exertion can be performed in multiple ways. But from a rehabilitation standpoint, we want this to be done in a manner that targets the actual tissues or the dysfunctions that must be addressed. So what we're really talking about here is making sure when we do exercise for a therapeutic benefit, that we're doing it that targets the right tissue or the right system in the body. And this ties into something that we call the specificity principle in the world of strength training, kind of this world of kinesiology and human movement, where specificity refers to whatever kind of changes we want to make. Well, we need to make sure that the inputs are similar and very specific to the outputs that we're trying to achieve. So a very, very overly simplistic way of thinking about that is if you injured your ankle and you needed your ankle to become, let's say, physically stronger, well, doing bicep curls for your arm, it's not very specific for kind of the adaptations we're trying to make to the ankle. Now, it's the right type of tissue. Okay, we're trying to strengthen muscles and tendons and ligaments by lifting weights and doing bicep curls, but it's for the wrong body part. So it's not very specific to helping get the ankle better. So probably a bit overly simplistic of a concept, but again, I think everyone can appreciate where this concept of specificity is very, very important for rehabilitating physical injuries. Another one that you could think about is, okay, well, I got a nerve dysfunction in my arm, and I need to get that nerve to become stronger and healthier again. Well, if that's the case, then doing an exercise that does not work to help improve the health and function of that nerve, it's not very specific, we don't get good results. So as long as we're going to exert the body in some way, we want to make sure that it is done in a manner that targets the actual dysfunctions or the tissues that need to be taken care of. So probably a little bit of a tangent on that, but just to make sure that we're starting to lay the groundwork for what we're talking about with exercise and where we're trying to go with this. Now, when we talk about these kind of definitions of exercises, I alluded to this a moment ago, but we don't always have to consider exercise to be something that focuses purely on muscles. We can kind of think about other types and times where we need to create what we call exercises for injury recovery and injury rehabilitation, but exercises that don't involve muscles. Now, I'm just going to run through a couple examples here. So we're not actually saying that what we are doing here is we're not always strengthening muscles or strengthening other parts of the body in certain ways. And there's ways that we can do that, such as improving what we call motor control. So we can have exercises for something called motor control, where we're not necessarily trying to create physical robustness adaptations within muscles and tendons and ligaments, but rather we're trying to enhance what we call the neuromuscular communication between how the brain and the nervous system coordinates movement and talks to the muscles that produce our movement. Because sometimes we can have the right amount of strength, but the strength isn't an issue. It's not what's causing pain. It's more inadequate movement that is dysfunctional and stressing tissues and stressing joints in ways that shouldn't be happening. So we actually need to improve our ability to move. And that's a great example of how we will use exercise. Sometimes it's not focused around strengthening muscle tissue, but rather optimizing our motor control or our movement capabilities. So that's kind of a neuromuscular type of training, or what we call, a retraining education type of exercise. We can also have exercises where we talk about how do we get nerves to become healthier or decrease sensitivity from nerves. Oftentimes I'll have patients where we got to work on exercises that we call nerve gliding or nerve flossing, which are specific movements that, again, we're not trying to rehabilitate maybe muscle in this case. We don't need the muscle to heal up. We don't need the muscle to become stronger. What we need is basically for the nerve to chill out. It needs to relax. It's a little bit sensitive. And oftentimes you can have these movements called nerve glides or nerve flossing. And so that's a nervous system-based intervention, a nervous system-based exercise. We can have times where we actually have to really go down the cognitive route and have a patient in the clinic or a patient at home perform what we call mental imagery, where they're having to imagine and perceive movement taking place without actually doing any physical movement. This is very, very important for kind of sneaky types of pain that people will sometimes present with, or chronic pain that's maybe not playing by the rules. And so having these mental imagery exercises where people have to try and visualize a movement happening or try and almost feel a movement happening, very, very important stuff. So more of a cognitive-based type of exercise approach. That gets really interesting when you have to look at the world of example of something called graded motor imagery, which I'm planning on doing a podcast episode on. Really cool stuff when you talk about nasty types of pain that doesn't play by the rules of what traditional rehabilitation requires. You're using different types of mental imagery and what we call left-right discrimination between sides of the body to help the brain kind of rewire and kind of reduce a concept or a phenomenon, what we kind of have termed cortical smudging, of the brain having a harder time interpreting parts of the body and what's going on. It's really cool stuff. I'll be doing a podcast episode on that in the future. But again, we can also have different types of exercises where we're trying to get the nervous system to reset itself a bit better. Maybe not through nerve gliding, which I mentioned a moment ago, but maybe desensitization of a nerve, where we help to kind of calm the nerve down by exposing it to different types of tactile pressure and stimulus. So whatever it's going to be, the takeaway of all of this that we're kind of talking about, these different motor controls and nerve flossing and all that, is to let you know that rehab exercise is not just about muscles. It's not just about tendons, because different conditions require different interventions to take care of the tissues that are causing the issue, or to correct the underlying condition or improve the underlying condition that's taking place. But again, I think for most people in this episode, we'll likely be kind of thinking about this through more that musculoskeletal system of muscles, bones, tendons having to heal up, and doing exercises to help promote healing with those types of tissues. But nonetheless, just keep in mind that we can really expand definitions of exercise to include more than just muscles. But I think most of this is going to be grounded as we go forward here in kind of the muscle rehab compartment, if you will. So let's quickly talk about the difference between what we call rehab or prehab for exercise. So rehab is short for rehabilitation, and prehab is short for prehabilitation. So a prehabilitative exercise refers to physical movement and activity that's performed to prevent injury and dysfunction from arising. So pre, meaning like preceding, we're trying to get out in front of an issue before it becomes an issue. And then we also have what we call rehabilitative exercise. And I think this is what most people are familiar with, and certainly what we're really focusing the topic of this podcast episode to be around. And that is an injury-based recovery strategy from, trying to recover from what's already happened. So we're using physical movement and activity and performing it after an injury or dysfunction that has arisen, with the intended therapeutic benefit of reducing and hopefully eliminating the issue. So, prehabilitative versus rehabilitative. Now, both prehabilitative and rehabilitative exercises are creating positive adaptations within the body. But what's important to know here is that the parameters of how each category of exercise, the parameter of how each category of exercise must be performed can often be quite different from the prehabilitative to the rehabilitative exercise. So keep that in mind as we kind of move forward. But realistically, we got another kind of thing we got to consider here. So the $1 million questions that we have to ask ourselves with rehabilitative exercises is what are we trying to accomplish? If you're spending time doing an exercise, what is it that we're trying to do? Well, ultimately, we are using that exercise to stress the tissue within our body in a manner that helps it to understand that change needs to take place. So we're putting a little bit more of a stress or an input into that tissue than what it likely wants to tolerate, but done so, in the right manner so that the body understands that it's having trouble performing this task, and it will therefore start to adapt to be better able to tolerate that task or that stress. And that's how we use these exercises to help promote injury recovery. Now, another question we can ask ourselves here is, why are we using exercise? And I think most people understand this, but it needs to be perfectly clear that the body will adapt to become more resilient against what it finds to be challenging. Now, that being said, the challenge must be appropriate and specific to the issue at hand. But if we get all the parameters right, which we'll talk about in a moment, the body will become more resilient, and it will therefore start to be able to create a better outcome for us in terms of higher quality of life, ways in which we're moving better, we have less aches and pains, and we have more of a buffer against injury from occurring or arising. So we have a powerful medicine here if we think of movement as medicine, and that's a really, really important thing that we need to understand. Now, we'll get more into that movement as medicine stuff in just a moment. But first, as we kind of keep working down this concept of using exercise to rehabilitate the body and kind of these strategies that must take place when we're rehabbing exercises, it's really important that we quickly talk about what we call active and passive strategies as a means to help promote healing and recovery within the body. So, injury rehabilitation, it often consists of these active and passive interventions. It's rare to kind of only need one or only have to have one. I mean, there's a whole world we can go down about kind of different philosophies on this and kind of different times and circumstances where these interventions are required. But let's quickly talk about the definition of an active intervention with helping to create robustness and healing within the body, and then what we'll define a passive intervention to be as well. So an active intervention, we're saying it's a stimulus created internally in the body through physical movement and activity. And by internally, we're saying that it's initiated from within the body. So this means anything where you're kind of actively engaged in producing that movement or producing, the change that you're trying, using the exercise where you're producing activity in a way to create the change. So we can think about walking. Walking would be an active intervention. We can think about resistance exercise if we're trying to strengthen a muscle or give a muscle more endurance, its ability to resist becoming tired. Well, resistance exercise takes, it's an active intervention. It takes energy that we must produce to do that. We could even consider different types of stretching to be an active intervention. We talk about what we call isometrics or isometric muscle contractions to be an active intervention. We talk about balance training, talk about kind of controlling our breathing, talk about performing something like yoga, all of those in which you are actively putting forth effort in some capacity. That's an active intervention. And how we use those active interventions will be different from case to case and scenario to scenario, but that's what an active intervention is. And then a passive intervention is kind of, it's the opposite. So a passive intervention refers to a stimulus that's delivered externally. So it's not coming within the body, but it's coming from outside the body and then being delivered to the body, typically through a device or a healthcare practitioner, someone who's working with you. So there's, again, no shortage of examples we could use here. If you have a TENS unit, so it's those little kind of buzzy packets that people stick the electrodes onto their arm or their ankle, and it makes it feel like it's buzzing and tingling. It's a pain distraction technique. TENS is transcutaneous electrical nerve stimulation. That's what it stands for. That would be a passive intervention. We talk about massage therapy, or a physical therapist performing manual hands-on therapy. Be more of a passive intervention. You see people using percussion guns on themselves to kind of limber up their muscles, kind of get things to be less stiff and sore. That would be a passive intervention. Things in clinics like shockwave therapy, intramuscular stimulation, or what we call IMS, heat packs, ice packs, those are what we would consider to be passive interventions. Now, both active and passive interventions absolutely have a time and place. You'll often kind of get into these worlds where people sit in different camps of, hey, you should never use passive interventions, or you should only use active interventions, or whatever it's going to be. I sit in the camp that optimal outcomes are often achieved with a combination of both. Again, it totally depends on the unique circumstances of the individual and the injury. There's times where, I'm going to have people really only do active interventions, but there's times where the passive can help to certain capacities. And there's also times where there's so much going on with someone, you have to keep it passive for the first little bit. You think of someone just maybe freshly right out of surgery, massive surgery that they're sitting there in a hospital bed with, they might just need some passive intervention for a little bit. So whether someone sits in the active or passive intervention only category, it's up to them, but I believe that every tool has a time and place, and this is all very contextual based on what a person's trying to achieve, kind of where they're at in their unique circumstances. So with that being said, talking about active and passive interventions, one thing that we might often want to consider is that for many conditions, many times, physical exercise or an active intervention, it should absolutely be the foundation. So it's not to say, again, that that's the only thing to do, but oftentimes having physical movement and physical exercise that's working to achieve healing within the body should be the foundation for a lot of this. So then the question becomes, well, why not just use passive interventions only? So again, going back to what I said a moment ago, passive interventions, so things that are being done to you, that are done to your body without you having to actively engage in that process, they can be very helpful and are often used at different stages of recovery. So they can be helpful, for example, here in acute or brand new stages of injury to help with inflammation and kind of control the inflammatory process and hopefully reduce it. So we think about, you just had a nasty ankle roll. You just rolled your ankle. It's super nasty. Within 10 minutes, it's swelling up. It's becoming painful. These kind of acute inflammatory stages, you can use passive interventions of different types to help create a more optimal environment for tissues. Again, we won't get into what those would specifically be, but they can also be very helpful, these passive interventions, to create a healing response for later stages of an injury recovery. So kind of at the tail end to help augment kind of the body getting a little bit more out of the recovery process. There's some good stuff that comes with that. But there's a couple of things we got to keep in mind here. So when we're trying to make the best recovery possible, it's often that repeated bouts of stress are required to strengthen tissue and allow it to adapt and become more resilient. So what I'm saying here is this is not just kind of a one-off, hey, I just need to do an exercise 1 or 2 times and I've likely created enough change or I'm good to go. This strengthening, robustness creating process that we use exercise for, it's a slow process and it takes a lot of repeated bouts of imposing the stress on the tissue to get it to adapt to a point where we feel and perceive and notice the difference it's creating. And so that being said, not everyone has access to the passive interventions that they can use. And again, going back to that first step we mentioned a minute ago, if it takes repeated bouts of stress, this often must be done multiple times per week and for extended periods of time. So we're talking multiple weeks, multiple months, and even a year or more. And so that is going to largely require someone to be able to do this, largely at home or, in an environment that's easy for them to access to, that they have the ability to perform these exercises in. And so we need to make sure that we're feeling empowered. We're not just kind of sitting around at home going, well, it'd be nice to have these passive interventions, but I don't have access to them, and so I'm not going to do anything at all. There's usually something that can be done, even just with injury recovery, simple exercises at home. Now, this ties into this whole concept of these active interventions, so things that you can actively do with your body to lead to the decreased perception of helplessness, which then can foster healthy behavioral changes. Because so much of this injury recovery process is, again, it comes down to a lot of kind of the psychological component of it. If you feel helpless because you're sitting around at home and you don't know what to do to help improve your situation, it's not a good place to be in. And so if we can get someone engaged and actively take part in what they can repeatedly do to strengthen their body, get rid of pain, improve movement, improve function, well, that creates a behavioral change in which we're now taking the initiative to create that change. So it decreases that helplessness and that sensation of feeling lost or not knowing what to do. A patient who feels like they have the ability to take action and keep walking forward on that journey to recovery is going to do much better than the patient who sits at home not knowing what it is they can do. So that's why we often make such a big deal about physical exercise and movement. So the challenge then becomes that, if we're talking about exercising at home, well, what type of exercise can we do with what we have? Because not everyone has access to go to a gym for their recovery. And certainly few people have the ability to go to, a healthcare clinic, whether it's a physical therapy clinic or a chiropractic clinic, and just always go there day after day to get treatment or even perform exercises there. So there's a lot of ways we can just do simple strengthening and rehabilitation exercises at home. And we want to think about basic equipment like a tool, because every tool has a time and a place. You go into a woodworking shop and there's screwdrivers and hammers, there's saws and there's drills, right? And every tool has a usage, has a time and place. And so with some of the basic equipment that we'll often have people use to perform their exercises will be things like elastic bands, right? You can easily use elastic bands at home for a lot of different types of exercises. They're typically dirt cheap to get. You can get them at a lot of different places. Things that some people have at home or can use maybe in a fitness facility, something like dumbbells, right? Those little handheld weights that you grab onto and you do different movements with to strengthen your muscles. If you're in the gym, you might see things that we call cable machines, which are those kind of stacks of weights that have the typically black metal cables with handles attached, and you pull on the cable to move your arm or move your leg. Cable machines can be a great way to start to challenge the body in different ways. There's objects out there called kettlebells, which are the same as a dumbbell with basically just the handle in a different place. A kettlebell is kind of this round looking metal mass with just a little kind of bow handle on top. Great way that you can do a lot of different types of strengthening, movement exercises to help with your body. You often see people, even at home, just use little things like wrist and ankle weights. So those little kind of typically sandbag weights that you wrap around your ankles or your wrists. It gives you a little bit of extra resistance to move against without having to worry about holding on to anything. Oftentimes people, at home will even use little things like exercise pulleys, where you get a little set of pulleys and you clip them to the top of your door, and it lets you do different shoulder movements without having to fire up angry, sore muscles. Great for, when we're having to kind of rehabilitate different body parts with making sure we're not actually using the muscles. So the takeaway of all this is that however you're going to be needing to exercise, there's a lot of great simple pieces of equipment that you can use right in the comfort of your own living room, or if you are able to go to a gym or you want to go to a gym or a fitness facility, there's lots of great pieces of equipment that you can use there as well. And I think most of you are familiar with this, but again, it's worth going over this. Again, in a podcast, I don't quite know who my audience is with who exactly is listening. So we're just trying to cover as much as we can to make sure everyone understands the general gist of what's going on here. Now, you can also have little kind of balance apparatuses that you can use to improve your balance, right? Sometimes you see people standing on little wobbly discs or kind of these little rubber domes, we might call like a Bosu ball, to help kind of improve balance and improve stability. You get a lot of times where we need to rehabilitate the nervous system, the neuromuscular system, or strengthen muscles in the foot and ankle and legs in order to improve balance. So there's lots of ways that we can improve balance with different pieces of balance equipment. Sometimes you'll see people using big, round, inflated balls, which we call a stability ball, or a Swiss ball, or a physio ball. And those big, kind of round, rubber-looking balls that are filled with air. A lot of great things we can do with just very basic, inexpensive pieces of equipment. So that's just kind of a basic, just a basic walkthrough of just some things that you might see in different types of healthcare clinics that are helping to have people perform exercise, or certainly in gym-based fitness facility environments. And again, you can get a lot of these things for home use as well. So a moment ago, I talked about an analogy where we can think of physical exercise as a physical medicine for the body, because it absolutely is. So there's a phrase that we often use in the healthcare world, which is movement is medicine. It certainly is, but we do need to get the parameters right if we're going to get the most out of that medicine that we're essentially taking. So in that regard, here's kind of the analogy of how it works. We can think about the type of exercise that we are performing or want to perform. We can think of that like the actual type of medicine. Okay? There's medicine out there if you have a cold or the flu. There's medicine if you have a headache. There's medicine if you have high blood pressure, high cholesterol. So different medicine has an intended effect, and different exercise will have different intended effects as well. So we're going to think about the type of rehabilitative exercise as the type of medicine that we're going to take. And then we're going to think about the amount of exercise. So how much of this exercise are we actually going to perform? Well, we're going to think about that like the dosage of medicine that we take. Okay, so sometimes if you have a certain condition, or like you're sick and you got the cold or the flu, you might need a different dosage than someone else who has a similar type of flu or similar type of cold. So if we can get the dosage right, the amount of exercise, we'll get a better response. Because again, let's say if you had a headache and you said, hey, I'm going to take just one little sliver off of this aspirin that I'm going to take for my headache. Well, if you only took one little sliver, that might be the right medicine, okay? But the dosage is not enough to create the effect that we want. Now, that being said, if you just swallowed the whole bottle of aspirin, well, that would be too much, right? And you'd have a whole new set of problems. And so when we think about the amount of exercise that we're going to perform, too little doesn't give us the effect that we want, but too much can create a new set of problems. We become more sore or make a condition worse. So we got to get the amount that we perform to be an optimal amount. Now, when we're doing a movement for a rehabilitative exercise, we can think about the intensity of that exercise. So how hard is it to perform that exercise, or how easy is it? We can think of that like the potency of the actual dosage of that medicine. So you can have a medicine that's the right medicine, but the actual kind of the concentration per dose is maybe too low. It's a little bit diluted. It's not quite the right potency or power. Maybe it's a weaker acting type of drug. Well, again, if we have the intensity of the exercise, if it's too little, again, we don't create the response we want. But if we make an exercise way more challenging than it needs to be, even if it's the right amount, hey, I did 3 sets of 10 repetitions, but every repetition was extremely difficult. Well, maybe you did the right amount, which was 3 sets of 10 repetitions, but the intensity, because every repetition was so hard, that might have been too potent, and now you're more sore. You've kind of created a new problem for yourself. Or maybe you do 3 sets of 10 repetitions for an exercise, and that's the right amount, but every repetition on every set was incredibly easy for you. Well, again, that's going to be a little bit less of a potency in that dosage than we want. So we need to consider that. And then, of course, we need to consider the frequency of how often we perform these exercises, just like how often we're to take our medication. Do we take the medication once a day? Do we take it twice a day? Do we take it once every couple of days? We need to make sure that that dosage of how often we're taking it is ideal as well. And if we get all of that dialed in, well, then we create some really profound healing effects to the body if we do that for a long enough period of time. So just as different medications can treat different conditions, so can movement and exercise. So again, if we talk about different types of tissues that we're trying to heal up in the body, and we're talking about different types of movement as medicine, well, we can think about using, like we use a lot in the clinic, nerve glides for what we call mechanosensitization of nerves. The nerve becomes sensitive to movement. We're trying to desensitize it. We do that through nerve gliding, nerve flossing exercises, and that's for neural tissue. We can talk about using exercise if we're going to try and create healthy adaptations for tendons, which a tendon is what anchors a muscle onto a bone. It's kind of thick, gristly tissue. Well, you can perform a type of muscle contraction called an isometric, where you're contracting the muscle, which will put stress onto the tendon, but without producing movement. So if you think of a bodybuilder posing on stage, flexing his biceps, he's really, he's contracting that bicep, which puts stress on the tendon, but he's not producing movement. He's performing an isometric contraction. And you can use isometric contractions for what we call an analgesic effect. So it's kind of pain dampening effect. If the tendons on a certain muscle are sore or irritated, you can actually use what we call that isometric contraction to decrease pain, decrease tendon soreness. You can use different types of what we call dynamic stretches. So taking muscle and tendon tissue and the fascia that wraps around that muscle, and you can do those dynamic stretches to improve the mobility of that muscle fascia. So muscle fascia is like saran wrap that wraps around the muscles themselves, kind of like this kind of saran wrap. Or if you think of like a sausage casing and you stuff the sausage inside that little kind of casing on the outside, it's kind of what fascia is. And you can use movement to improve muscle. You can use movement to increase the fascial mobility and decrease what we call myofascial pain. So there's all these ways that we can perform these exercises, but we want to think of whatever the exercise is for and whatever it's trying to achieve. We want to think of it like that medicine analogy, where we're getting it done in the right manner as a means to promote the healing response that we're after. Now, that being said, we're going to tie into, now that I use it all the time with my patients, the concept of exciting versus effective. Because ultimately, rehabilitation exercises, they don't need to be exciting. They just need to be effective. And I preach this to my patients a lot, because no one wants to do exercises for injury recovery. Like I get that, and I fully acknowledge that when I work with people. But that being said, you can't always make them exciting. I mean, there's lots of ways in which you can, and that's awesome. If you have the ability to find a way to turn it into a game or make it more stimulating mentally, that's wonderful. But at the end of the day, I think sometimes people get caught up on seeing a certain exercise performed, whether it's on social media or through a friend or anything, and they feel it's the right thing to do because it looks great and it's pretty exciting. And it certainly could be. There's times where you can do some really exciting stuff and it's the perfect thing to do. But at the end of the day, the exercises that a physical therapist gives you, or any other healthcare practitioner, or even your personal trainer, whatever it's going to be, it doesn't have to be exciting. It just has to be effective. Because I think most people out there would rather have an effective exercise that, if done consistently, will get them the results that they want, rather than one that's exciting to perform but doesn't give them any therapeutic benefit. So I often just, when I first started out doing physical therapy, I try and sugarcoat it a lot of times with patients and tell them that it can be really fun, but it's great when it is. But I'm at a point now where I say it doesn't have to be fun; it just has to work. So keep that in mind if you're finding that you have to put in the time and the effort with various injury rehabilitation exercises. Again, if you can make it engaging in some way, that's awesome. It certainly helps. But sometimes it's really just about putting in the work and just accepting that there's kind of this mundane aspect of maybe what you have to do if you want to make sure that you're getting the results you want. I think if we go to the medicine analogy, the way to think about it is sometimes like medicine tastes awful. Like if you have like some type of cough syrup or some medicine that you have to swallow and doesn't taste very good. But if you know it's going to work, then you just kind of, in a sense, power through and get it done, right? So I think that's another way that you can think about it. Now, one pro tip that I'll give you here is that if you can find a way to make an exercise more meaningful, then you'll likely have better exercise adherence and overall outcomes. And meaningful doesn't necessarily have to mean exciting. I mean, it can, but if you can find a meaning for why you're doing a movement, then what happens is it helps you kind of tap into that desire to kind of stick with it. So a great example, and one I'm just kind of making off the top of my head here, would be you have someone performing a knee strengthening exercise because they got a really sore knee and it hurts to bend their knee, right? And let's say in this example that I'm making up here, you say, hey, we got these little squat exercises you got to do. You got to practice squatting, right? And so the person's practicing that. And if they don't find meaning in that, if they can't tie it into maybe a real life scenario for something they might enjoy in a real life scenario, maybe it's harder for them to do it. But then if they say, hey, well, this is going to help because I like gardening in the summer and I like getting down on my knees to be able to bend down and be pain-free so that I can do my gardening. I can plant plants and, create this beautiful garden. But they say, but I can only do that if my knees aren't going to be hurting. And this exercise is going to help my knees not to hurt. Well, then you can kind of find meaning in the movement. You can make it a bit more meaningful. And I think oftentimes for a lot of people, that really helps to make sure that they're going to stick with it, right? It can be boring, but holding on to the meaning of that exercise and how you can see it enhancing your quality of life and other day-to-day tasks and activities you want to do, I think that's a pretty profound thing to do. So if you're able to find meaning in your movement, that's awesome. Now, throughout this whole entire injury rehabilitation process, it's often really, really important that you starve the ego. So you have to, depending on where you are with an injury and you're kind of maybe back to square one of, hey, I'm really banged up. I'm in a lot of pain. I want to get back into doing these activities. You have to have something you want to be working towards, right? But humility will go a long way with ensuring that you have optimal recovery. And so in that regard, you need to leave your ego at the door, because sometimes we're going to want to push a little too hard, or we're going to want to progress a bit too fast because maybe we're frustrated that we can't do what we used to, and we want the recovery to go a bit quicker. And when that happens, it's good to be motivated, but sometimes it can get the best of us. So you really have to humble yourself and know what your limits are for where you're at in your different stages of injury or recovery. And a great example that came to mind when I was kind of putting this episode together was in the book it's called Gift of Injury. It's a book by Dr. Stuart McGill and Brian Carroll, who's a kind of world champion powerlifter. And it's a book that talks about Brian Carroll's just catastrophic kind of back pain that he was having. He had a spine that, basically if you kind of read the imaging reports, kind of looked like a bomb went off in his spine in a sense, and decrepit amounts of pain. and went to all sorts of professionals, and everyone's like, look, like, you need all this neurosurgery, your days of lifting are over, blah, 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 blah. And the book talks about how Brian found Dr. Stuart McGill, and throughout what I remember to be about a 2-year process of him doing all sorts of exercises and movements, he got back to being pain-free and actually even being stronger than before. But what I liked the most about the book was that Brian talked about he just had to humble himself completely. Here's a guy that was one of, if not the strongest guys on the entire planet with the amount of weight he could lift. And he would go into the gym and, he'd be back to just, only lifting the barbell for, prolonged periods of time and doing exercises like religiously for movements that, his friends or colleagues would kind of go like, really, you're doing that? And he knew that if he wanted to get where he needed to keep himself humble and not progress things too quick, and just kind of trust the process. And so the book's really good because it talks about how that extreme humility kept him on track. He didn't get derailed and have a lot of these setbacks, but his recovery only took place because he was willing to humble himself, not let his ego get in the way. Hey, here's a guy that can, deadlift, hundreds and hundreds and hundreds of pounds and squat hundreds and hundreds and hundreds of pounds. And yet, he took all that weight away and just went back to very light loads, very, very, very controlled progressions for such a long period of time throughout this kind of 2-year process. But his success was largely, I think, attributed to his ability to humble himself. So you need to challenge yourself, but you can't get too carried away and just try and push through at unreasonable rates or at unreasonable intensities. And that's a bit of a balancing act, but one that you really need to keep at the forefront of your rehabilitative exercise journey, right? So again, it's a good book, especially if you have back pain and you're an active person. I think Dr. McGill has tons and tons of great stuff out there, so certainly look at a lot of his stuff. But Gift of Injury, great one for anyone who's especially a power lifter or just an athlete who wants to learn about more kind of back rehab strategies. So with all that being said, exercises don't have to be exciting. They have to be effective, and you need to starve the ego. All of that. Well, essentially what that means is like you're going to have to, in some regards, likely lean into the boredom a little bit. Okay. Maybe this isn't the case if you got an injury that only takes 1 or 2 weeks to get over. But I'm really trying to set the table here for people who have a long ways to go in this journey. People who are really banged up or have lots of chronic nasty pain. And if that's the case, I want you to know that the best patients, at least who I work with, who have the best outcomes are those who can just accept that so much of this exercise rehabilitation process is going to be this boring, mundane task, and that they just need to understand that it's what they're up against. But if they can accept it and do it anyways, they are the ones that I often find not only have the greatest, recovery, but also a recovery that quite surprises me in a lot of ways. It's really cool what a lot of people are capable of when they stare into the face of knowing that exercise rehab is not sexy, it's often not exciting, but that the right exercises and movements, no matter how bored they might be, will absolutely get them to where they want to be. So there's something to be said about putting in the work. That's what we're trying to say. Now, in that regard, there's a quote that came to mind when I was putting this episode together that is one of my favorite quotes in a lot of ways. It's by Tony Dungy. So he was an NFL football coach and wonderful man. I love so much of what he's achieved in his personal story. And he's got a quote, and I believe it was in one of his books I read years ago. And I believe he's the one who said it. Maybe someone said it before him. But the quote, as we talk about kind of leaning into the boredom here, the quote is that champions are not champions because they do extraordinary things. They are champions because they do the ordinary things extraordinarily well. And I love that because I think if every pursuit that we ever had to go after was exciting and sexy and didn't involve boredom and kind of putting in the boring grind day after day, I think if every pursuit was like that, where it was just all this exciting stuff, everyone would be doing these amazing things, but the reality is it's the people who can accept that it's not going to be exciting and glamorous, but pay attention and really stick to the process despite it being boring. I think that's a wonderful, wonderful thing. And it's pretty cool, the things we're capable of when we just accept the task in front of us and do the ordinary things extraordinarily well. So that then leads into the perfect concept of intentionality. So intentionality when you're performing your rehabilitative exercises. So no matter how boring or mindless an exercise might seem, you need to be intentional when performing it. So what do we mean by intentional? Well, the definition we'll use here is the fact or quality of being done with purpose or intent. And that's an important thing we need to be aware of about being intentional when we do an exercise, because it's all too easy to go, okay, well, if this is going to be boring, I'll just shut my mind off and I'll do my repetitions, I'll do my movements. And while I'd advocate that, doing that's better than nothing, I think we often cheat ourselves out of what we get out of those exercises if we're just kind of shutting our mind off and not being intentional and paying attention and focusing on every single movement and exercise that we're doing. I think we can get very sloppy on the execution, where we do the movement a bit too slow, a bit too quick, or not with the right range, or with the poor quality movement. And I think then we're taking a medicine, right? And we're diluting it a little bit, or we are tainting it a little bit in a way that just won't have the therapeutic punch or impact that we need it to have. And I see that quite a bit in clinics where people will be doing exercise, or gyms for that matter, when I'm in the gyms, and they're doing exercises, but the quality and intentionality is not there. They're distracted and they're turning their minds off. And hey, I get it. Sometimes it happens to all of us, myself included. But if you can be focused in and pay attention to every rep and be crisp and dialed in and know what it is you're trying to execute on every rep, I think there's something to be said for people who get way more therapeutic benefit when they're staying engaged and being intentional rather than just mindlessly kind of going about the task and shutting their brain off in the process. Now, it's not to say that every exercise has to be like that, but in the world of like the strengthening and kind of the ones that take a lot of effort, I think it does. So basically what I'm trying to say here is that a commitment to focus at all points throughout each and every rep of every exercise will absolutely ensure that you get more out of your efforts. And then I think your therapeutic recovery will be much better off for it. So with that being said, then I guess we get to talk about, understanding the process. And in saying that, what I'm saying is that it's critical to have an understanding of what you're up against with your injury or your condition. So you're going to have to put in exercise time to do exercises, and it's going to take work and effort. But you have to understand what you're up against in terms of considering the type of injury that you have, because all of these kind of different things you're up against are going to influence how you need to go about tackling the issue. So you need to consider the type of injury or condition that you have. And by that I mean, is it an acute, brand new injury that you now have to use exercises for? Is it a chronic or old or long-standing injury that you now have to use exercises for? Is it a sprain where you have overstressed or torn ligaments? Is it a tear of a muscle? Did you break a bone? Is a tissue very degenerated, and so now it's structurally weak and doesn't have a lot of endurance? Those are examples of kind of the type of the injury or the condition that you can have. And that right off the bat is going to determine how we need to use exercise to get you back to where you want to be. And it's not to say that you do this all on your own. You need to hopefully have someone who can help you understand this and set you up with the right exercises. But your exercises can only be selected, and the movements and the amount and the frequency and the intensity of these exercises, they all depend on what the type of injury is, among a few other things. So we need to consider not just kind of the type of injury, but the type of tissue that has been affected. Again, we have muscles that can be torn. We have ligaments that can be stretched. Or we can have nerves that are hypersensitive. We can have cartilage that's a bit arthritic and unhealthy. And so all of that, it determines kind of how exercises need to be performed, which exercises need to be performed, and even your timelines for how long it's expected to take before you notice improvement or get the recovery that you're after, or even the extent of recovery that can likely be attained. So that's another thing that we need to consider. And then, of course, we need to consider the severity of the injury or condition as well. So we've talked about the type of injury or condition. We've talked about the type of tissue that has been affected, but even the severity of the injury or condition itself is going to influence everything pertaining to rehabilitative exercise. You can have a simple injury. Okay, you rolled your ankle, stretched it a little bit. You can have a complex injury, multiple tissues, multiple structures in your body have been affected. You get in a bad car crash, right? And you needed surgery to repair a broken bone, but you also have whiplash. So you've got nasty neck pain. You've got scrapes and cuts all over your skin, right? That could be a complex injury with lots of things going on. You have a moderate injury or just an advanced injury, or anywhere on kind of that spectrum of very simple and straightforward and mild to very complex, very severe, very painful. We need to consider all of these things when we're figuring out how we're going to use movement as our medicine. So that's kind of an important part of understanding the process. And then that leads into understanding the general timelines of recovery as well. And I think I'll likely do a podcast episode on this in the future where we talk about kind of stages and timelines of injury recovery. But just to go through it real quick, your first stage, whenever you have an injury that you need to recover from, is what we call the inflammatory stage. And this is just a stage where the injury has happened, and then the first thing that happens is your body kind of starts to kind of change the local environment in order to get the process underway. So typically this inflammatory stage will last between a few days to a few weeks. And it's that classic stage of kind of having, again, if you rolled your ankle gets hot, right? You touch it and it feels hot. It's swollen, it's red, it's got lots of pain. That's an inflammatory stage. And that is going to require very unique strategies for exercise, active interventions, passive interventions, as a way to start kind of getting you through that stage quicker to get that inflammatory process under control. And then you have the second stage, which we call the proliferative stage. So this is the stage where your body is now laying down new tissue. It's got the inflammatory response under control, and it's now laying down new types of tissue to help, again, kind of get things structurally taken care of and repaired. Now, this proliferative stage typically lasts between 1 to 2 months, again, just as a general kind of guideline, and that will require different strategies and inputs for exercises and movements. And then you have what we call the third stage, which is the remodeling stage. And this is a stage where your body is now taking that new tissue it's laid down and it's starting to organize it in a manner that helps to, again, make that recovery more complete. The new tissue that it's laid down is gaining strength. And this whole remodeling stage can take anywhere from a few weeks to upwards of a couple of years. And understanding these timelines is very important so that you have a better understanding of what the therapeutic exercise process is going to look like in terms of whether you're in an inflammatory stage, okay, which type of movement and rehabilitative exercises are we going to use, to whether it's the proliferative or remodeling stages. We have to take all that into account as well. And again, it's not that you are trying to figure this all out on your own, but rather having someone hopefully to set you up with some of these initial kind of principles so that, if nothing else, you can't make it into a clinic a lot. You have to do a lot of this, at home. Well, you now have kind of the blueprint of how that needs to unfold because you've had a practitioner help set that up. They've evaluated your injury. They've evaluated your condition. And now you're able to start kind of doing the right things at home and not just in the clinic, right? So please don't think that I'm saying you have to figure this out on your own. Again, I'm taking something that takes years of learning and just trying to squish it into, this short little podcast episode to hopefully just expand your awareness a bit, just point you maybe in the right direction, nothing more than that. So one other concept then to quickly get into is the concept of progressive overload. Now, this concept specifically applies to, again, we're trying to create adaptations typically to muscle tissue and tendon tissue. I mean, we could expand it to other tissues as well, but really I think the simplest way to think about it is for muscles and the tendons which anchor the muscle onto our bone. We're going to talk about progressive overload, which it's what we need to do to help ensure that progress with our exercise continues to occur. Because as the body adapts to the initial challenge that you give it with an exercise, at a certain point, if you keep performing that exercise enough and the body begins to adapt, it will no longer begin to receive adequate challenge from that exercise or movement, because the body initially said, hey, this is a bit too much. This is more than what I'm used to. It's a bit stressful. I better build up and become stronger so I can tolerate this. And once it's gotten to that point, well, if you keep using the same intensity or the same resistance, the body says, I got this. I don't need to adapt any further. And so your job at that point, and hopefully you can have someone just, again, kind of help you understand when you need to progress the exercise, is at that point you progress the exercise just enough so you repeat the process. You now stress it just a little bit more than what it wants or what it's used to, and you keep that process going. And from an injury recovery standpoint, you repeat that at least up until where your strength and kind of health was before the injury happened. Now, realistically, you want to keep doing it so you become even stronger than before the injury happened. But this progressive overload is incredibly important. And so I think of an example one time where we had a gentleman come in, he had tennis elbow. So he had really, really sore tendons on his outer elbow. It's a very common, annoying condition. And he was disheartened because he was, thought he was doing his rehab exercises correctly, where he was doing a resistance exercise to strengthen those tendons. And he'd said he'd been doing the exercises for like 1 or 2 years, but he was disheartened because it wasn't getting any better. Well, lo and behold, we asked him a little bit more about it, and he had been using the same weight, like this little weight for a couple of years. And so in that regard, he wasn't progressing it. And it was amazing where once we just increased the intensity a bit and kind of talked about progressive overload with him, he came back like 4 to 6 weeks later and he was remarkably better. And so sometimes we, in the rehab world, we get really technical and we overthink things, but sometimes we got to go back to that, just the basic principles of what the body needs to adapt. And so in that case, we said, it would have been nice if someone before had told you about this progressive overload you need to follow. But once he did, the recovery came quite quickly and quite noticeably. So the takeaway is that when you do your boring exercise and it's not fun to do, but you're doing it anyways, and it doesn't feel like it's challenging you quite enough, then you either increase the amount of the exercise, right, or you increase the intensity, or you increase the frequency, or some of those parameters we talked about earlier. And that helps you to kind of get more stress in the tissue, and you get the tissue to adapt, and you keep working it. Now, in that regard, it's important to understand that sometimes exercises aren't going to feel good. They're going to be a little bit uncomfortable in terms of producing some physical discomfort. Now, again, this is all the physical exercise. We're not talking about the cognitive exercise per se, or some of these other kind of exercises where we're not producing mechanical stress onto our tissues. But when it comes to these actual exercises of strengthening muscle tissue and these tendons and these other tissues that we often think about for traditional rehabilitation exercise, sometimes it's going to produce discomfort, and that can actually be a good thing. So there's many times where it's actually warranted or required to generate sensations of physical discomfort with exercises. Now, this isn't the case for everyone. It all depends on numerous factors, but for certain times, this is a very important thing to understand. So not all hurt is harmful when performing rehabilitative exercise. That's the important point to understand. Now, again, this is very contextual. There's so many nuances that we would have to talk about, which we're not doing in this episode. But if you're working with someone, a qualified healthcare professional, and you're feeling discomfort, ask them and make sure that, hey, is this a good discomfort? Because a lot of times we actually need to produce a physical discomfort through the tissue to ensure that we're giving it a little bit of that stress that it's not used to so that it will begin to adapt. Now, we're not saying it needs to be painful. So pain would be, ooh, this hurts so much, I need to stop right now. But interpreting pain and discomfort is a very, very important thing when it comes to rehabilitative exercise. It's one of the main things that I always have to keep at the forefront when I'm working with patients and helping them with rehabilitation. And oftentimes, if people are really scared of pain or they don't understand it in ways that I feel that they should or ways that would be helpful, there is a great book out there called Explain Pain. It's a book by David Butler and some of his other colleagues. And this book, Explain Pain, it's a fantastic book for anyone who's apprehensive about pain and not sure what to make of it. The work that David Butler and his colleagues have done is just, it's phenomenal stuff. Very, very reputable people. So Explain Pain, it's a wonderful book if you need something to read about for better interpreting pain and not being as fearful of pain as we often feel that we are. So the other thing that I'll quickly mention here is the concept of orthopaedic hygiene as it ties into physical exercise and physical recovery. So orthopaedic hygiene. So this is where we talked about a minute ago, even when you feel like you're fully recovered from your injury, you've been doing your exercises, time has helped and you've had the right people help evaluate you and treat you with passive interventions and active interventions, and you've been doing all your strengthening exercises and everything else at home. Once you feel like you're back to where you were previous to your injury, you should still keep doing your exercises. Now, how often you do them and everything else can certainly change a little bit, but you really want to think of this like brushing your teeth. This is an analogy I use all the time. Brushing your teeth is a regular habit that you do, even if you don't have any cavities or dental issues. So I find it very interesting where we're taught the importance of daily actions for maintaining our oral hygiene, right? Everyone knows, hey, I should brush and floss a couple times a day. And that, I haven't been looking after my teeth that well, now I got a cavity. But oftentimes people forget that it's the same with the rest of our physical body. So, so you don't have any cavities or, issues per se with your muscles and your bones and your tendons and your joints. Well, let's keep it that way. Keep the concept of orthopedic hygiene. So rather than oral hygiene and brushing your teeth, keep doing some of these exercises to make sure that you keep the cavities, the quote unquote cavities away. And once you're kind of where you're at with your injury recovery, if you get to that point, we're not saying that you have to kind of be doing these specific exercises, day after day, every single day, but rather just stimulating your body, going to the gym, moving around, performing a bit of resistance exercise, a bit of aerobic activity. That will absolutely help to kind of keep the cavities or the aches and pains from coming back, because you're constantly getting the tissue to adapt and either become stronger or stay where it's at. So very important concept to think about once you're back to where you want to be. Okay, don't just kind of say, I don't need to exercise anymore, because then the cavities are going to start building up. Okay, so let's talk about our practical takeaways here, as I've been rambling on for much longer than I thought that this episode would go on for. So things for you to kind of mentally chew on, or hopefully maybe take away from this episode. The first one, knowledge is power when it comes to having an injury and knowing you need to do some therapeutic exercise as part of the recovery process. You need to make sure that you know what you are performing with each exercise and what you're attempting to accomplish, what it is you're trying to accomplish. I think I said that wrong a minute ago. Make sure you know why you are performing each exercise and what you're attempting to accomplish. So if you can do that, you're off to a good start. And then you need to make sure you understand the process, right? What are the timelines looking like for when I can expect to feel better, when I can expect to start to see or feel some progress being made, okay? What type of tissue is it that's been affected that these exercises are going to help? Anything that you can do to kind of learn the more the basics of what you're up against is going to help in so many ways. At least I see it all the time in the clinic with my patients, for helping them to understand the process of what's ahead and what's going to be required of them to get better. Because it helps to align expectations where people go, okay, well, it makes sense that if it takes, this type of injury 6 to 8 weeks to get better, and I'm only on week number 2, well, you're not going to get disheartened, right? You're going to say, okay, I know I need to kind of put in a handful more weeks before I should start to feel or see these benefits taking place. Because when you get disheartened, it's frustrating because people can be doing all the right things and they just need a bit more time. Or again, they've had enough time, but the movements and exercise that they were doing, they weren't ideal, right? We got to make sure it's as specific as possible. So that's the first one. Knowledge is power. And then we got to talk about the importance of consistency, right? It's going to be likely boring in so many ways, but you have to do it, because the best exercise in the world, absolutely, it won't amount to much or even anything at all if it's not performed in a consistent manner. So this is where you just have to kind of lean into it. It's boring, but you have to keep with it, because consistency is everything to provide the repeated stimulations, the repeated stressors that the tissues need to experience in order to start that healing process and keep that healing process going. And so in talking about keeping the process going, you also need to, as the third practical takeaway here, keep the vision going, right? Make sure that you can stay focused. Okay, boring exercises, they can be incredibly effective if you're intentional and focused. And oftentimes people go, oh, this exercise didn't work. And there can be a lot of reasons why an exercise doesn't work, but oftentimes, from what I've seen so many times, it's at least in part because the exercise was performed in a very sloppy manner. The movement was off, the tempo was off. It wasn't executed with the right load or intensity. And so we've taken what should have been a very potent, powerful, precise medicine, so to speak, and it got diluted and it got tainted, and it didn't have the effect that it should have, because the movement was not being performed in a very intentional, focused, dialed in manner. So you have to keep the vision going, stay focused with it. It's not fun, but you just have to lean into the task ahead. So then the fourth takeaway is you need to make sure, get someone to help you with this if need be, but you need to dial in all of your exercise parameters based on what your injury is, what your condition is. The parameters that you need to make sure that you can dial in are things like sets, right? So you need to know how many repetitions you do. Okay, maybe you do 10 or 12 or 15 repetitions, but then how many times do you repeat that? So if you did 12 repetitions, that would be one set. Then maybe you take a break and then you need to do 2 more sets. So the right volume or the right amount is absolutely critical to make sure that you get the most out of your exercises. But it also needs to make sure you're doing the right resistance amount. Okay, how much or how little are you challenging the tissues that you're trying to get to adapt? How intense is that movement? What is the speed of that movement supposed to be? Is it going to be a slow, controlled movement? Does it need to be a little bit quicker? Now, typically slow movement is really good in the more brand new starting stages of these injury recovery exercises. But then the later stages, you might need to be going a little bit more quick. Again, it all depends. But get someone to help you with this if possible. Because if you can do that, you're dialed in, you're going to have much better, much quicker responses than if things are kind of less than ideal for the overall volume and the amount and the intensity at which you're doing these exercises. So that being said, with those takeaways, hopefully a couple things to chew on, I really appreciate you staying if you're still at this point listening to this episode. I often feel I ramble a lot in these episodes. It's kind of tricky when you're just talking to a camera and talking into a microphone without an interaction going on between someone else. So it's kind of an art form I'm still learning to master a bit. I'm hoping to have some guests on at some point. But so I feel a little self-conscious sometimes because I just talk and I talk and I talk. And I wonder if I've missed something or if I haven't explained something in the right way, or if I'm presenting it in a logical, flowing manner. But nonetheless, if you've made it this far, that's awesome. I really appreciate that. I consider just anytime someone is listening to this podcast episode, it's like time spent with someone. So that means a lot to me. And if you did find to get something helpful out of this podcast episode, please consider leaving a review. That would mean a ton to me. I'm just one dude trying to do all this myself, using all this podcasting video equipment, producing YouTube videos, little Instagram reels, whatever it's going to be. But it's a labor of love. I don't have the funds to hire a team or a crew right now. Maybe one day in the future. But right now, just a one-man show doing all this. So I'd appreciate leaving a review if you want. And then if you do feel that others could benefit from this episode, certainly feel free to share it with them. Hopefully try and get the word about helping people get pointed in the right direction to become stronger, feel like they can kind of take control of their situation a bit better. It warms my heart to know that I'm doing that. I just feel I'm called to give a lot of this back in whatever ways I can. And so with that being said, really appreciate you spending some time with me today. And I'll wrap it up like I always do in my content. I want you to keep looking after yourselves, keep looking after one another, keep making great things happen, and I'll see you in the next episode.